What changes when when obesity is now listed as a chronic disease versus when it wasn't?
I think the biggest thing should be acceptance of treatment, right? Because if we continue to see it as a lifestyle problem, then we're going to continue to beat the idea of it's going to be lifestyle, what's going to improve obesity and what's going to cause weight loss, right? So we're leaving it pretty much of the patient's responsibility on 100%. But when we see it as a chronic disease, one, we take the guilt of the patient from his shoulders or her shoulders, right? When we explain, I've seen this in my patients, when I explain to them, there's a huge genetic factor in a patient in particular with obesity, hormonal changes, aging, environmental factors. You can see the sense of relief of the patients that they always thought that it was up to them, right? That they were causing it. It says no other disease, if you diagnose somebody with hypertension, type 2 diabetes, you talk about lifestyle, but you still use medication, right? It's this obesity right now is still being not understood completely as with medication, to be used medication, but I think accepting as a disease, that's going to open up a chronic condition. We're not curing the obesity, we're controlling the obesity. Like we don't cure diabetes, we control the glucose. We don't cure hypertension, we control the blood pressure. Same concept with obesity.